What if your next doctor's appointment wasn't with a human? What if your disease was detected before any symptoms showed up and treated before it could harm you? Sounds like sci-fi? Well, welcome to 2025, where artificial intelligence isn't just changing healthcare, it's revolutionizing it. From robot surgeons with zero error rates to AI predicting pandemics before they happen, the future is here, and it's saving lives in ways we never imagined. Stick around, because what's happening behind hospital walls today could affect you and your family tomorrow. And what AI is doing with your medical data, that part might shock you. Welcome back to the channel. If you're new here, hit that subscribe button, because we break down the most exciting advancements shaping our future. And today, it's all about how AI is transforming healthcare in 2025. Over the last 5 years, AI has evolved from a medical assistant to a full-blown lifesaver. It's detecting rare diseases faster than specialists, automating surgeries with laser precision, and even reducing hospital wait times. But how is this all happening? And is it as good or risky as it sounds? In this video, we'll explore 7 revolutionary ways AI is disrupting healthcare, from diagnosis to drug discovery to personalized treatments. Let's dive in. 1. AI-powered diagnoses. Imagine walking into a clinic and getting diagnosed in under 10 seconds before you even meet the doctor. In 2025, AI-powered systems like DeepMind's MedPalm and Google Health AI are doing exactly that. These models are trained on billions of medical records, images, and lab results, identifying patterns the human eye might miss. For example, AI can now detect lung cancer on CT scans with 94% accuracy, often before symptoms even appear. In rural areas with limited doctors, AI chatbots are acting as first responders, helping triage patients, flagging emergencies, and guiding treatment steps. The result? Faster diagnosis, lower costs, and fewer misdiagnoses, which historically account for over 250,000 deaths annually in the US alone. But wait, what happens when AI gets it wrong? And who's responsible? 2. Predictive health monitoring. In 2025, AI is not just reacting to disease, it's predicting it. Using data from wearables, smartwatches, implantables, and genetic markers, AI algorithms can now flag health issues before you even feel them. Companies like Whoop, Apple, and Fitbit have integrated machine learning that monitors heart rate variability, oxygen saturation, glucose levels, and even mental health patterns. In fact, AI has now reduced emergency hospitalizations by over 30% in pilot programs across the UK and Japan by alerting patients and doctors days, sometimes weeks, before an actual health crisis. Even more mind-blowing, AI is now being used to predict strokes and heart attacks by analyzing subtle cues in your voice, movement, and even sleep patterns. But how much data are we giving up? And are we okay with AI knowing us better than our own family? 3. Robotic surgery. If you thought human hands were the most precise surgical tools, think again. In 2025, AI-assisted robotic surgeries have become the gold standard in operating rooms. With systems like Intuitive Surgical's Da Vinci Xi and Medtronic Hugo, AI-driven robots can now perform complex surgeries like spinal fusion or tumor removal with millimeter accuracy and minimal invasiveness. These machines don't get tired, they don't shake, and they can learn from millions of prior operations in real time. They're already cutting down post-surgery complications by over 40% and shortening recovery times by half. Even better, remote AI surgery is now enabling expert surgeons to operate on patients across the globe using 5G and haptic feedback systems. Could this mean the end of traditional surgeons, or will AI always need a human hand to guide it? Fourth, AI in mental health. Mental health is one of the biggest healthcare challenges of our generation, and AI is stepping in where traditional systems fall short. Platforms like Wiser, Wobot, and Replica are AI-powered emotional support agents offering 24/7 therapy, CBT sessions, and real-time mood tracking. These systems use natural language processing to detect emotional shifts, even when users don't say it out loud. But it goes deeper. AI can now predict depressive episodes based on your tone of voice, social media posts, or sleep cycles. In 2025, hospitals are already using this technology to prevent suicides and mental health relapses before they occur. Still, this raises major ethical questions. Are we replacing human empathy with algorithmic sympathy? Would you feel safe confiding your darkest emotions to a machine? What if that machine knows how to heal you? 5. Drug discovery and vaccine creation. Remember how it used to take years to create new drugs or vaccines? In 2025, AI is slashing that time to months or even weeks. AI models like Atomwise, In Silico Medicine, and DeepMind's AlphaFold are revolutionizing drug discovery by analyzing protein structures, simulating drug interactions, and predicting molecular behavior, something that once took teams of scientists years to accomplish. During recent outbreaks, AI was used to develop experimental vaccines within 30 days of the first reported case. Diseases like Alzheimer's, ALS, and rare cancers are now being targeted by AI-generated therapies with unprecedented precision. What happens when AI creates a cure faster than regulators can approve it? Could governments be the bottleneck now? 6. Hospital automation and workflow. Hospitals are notorious for long lines, paperwork, and burnt-out staff. In 2025, AI has stepped in to optimize the entire system. From AI-powered scheduling bots to smart billing systems, everything is now streamlined. Radiology reports are being transcribed in real time, hospital beds are allocated by predictive models, and even inventory is managed by AI. In some smart hospitals, patient discharge times have been reduced by over 60%, and nurse burnout has dropped significantly thanks to reduced admin work. It's not just about healing anymore, it's about efficiency, human-centered care, and letting doctors focus on patients instead of paperwork. But are we losing the personal touch in the name of efficiency? Is AI making hospitals too robotic? We're standing on the edge of a medical revolution. In 2025, AI is no longer science fiction. It's the invisible force saving lives behind the scenes. From catching diseases before they strike, to creating drugs in days, to giving mental health support at 2 a.m., AI is helping us live longer, healthier, and more informed lives. But with all this power comes responsibility. The question isn't just what AI can do for healthcare, but what we should allow it to do. Are we comfortable letting machines make life and death decisions? Or are we ready to partner with them for a healthier future? Let me know in the comments. Would you trust an AI doctor with your life? And if you found this video insightful, give it a like, subscribe, and share it with someone who needs to see where medicine is going. This is the future, and you're watching it unfold.